Hi students, let's analyze this INI November 2023 exam. So first, as the mail described, that the exam was divided into 4 parts. Each part consisted of about 50 questions. So 200 questions divided into 4 parts. Each part contained 50 questions to be completed in a duration of 45 minutes. So you can just think that you are attempting 4 different papers, each comprising of 50 questions in a fixed duration of 45 minutes. You cannot come back to the previous set, and thus you need to submit one in order to go for the next set. Now, second point was students that how many were clinical scenario based questions? About 80 to 85 were clinical scenario based, but the clinical history given was very simple, 2-liner, and to the point description was given in order for you to analyze how a patient, to imagine how a patient will come to you. So clinical scenario questions, yes, 80 to 85, but a very straightforward history was given, which is important for you to analyze the patient. Now next was image-based questions, about 50 to 55 image-based questions. In the recent trend, we have seen that it is the examiner's favorite to include an image. In fact, I have always been telling my students that including images only help you in diagnosis. It gives you an extra hint. Now, how to approach these images, students? When you are studying the theory, suppose you are studying pathogenesis and you are studying the histology. Now, understand the image along with your theory aspect. If you are studying hepatitis, understand the graph, which marker will be positive in vaccinated individuals, what marker will be positive in the active replication. So all these things you have to analyze while studying your theory only. So complete your images while studying the topic. Do not wait for the images to be completed separately, right? Try to include and understand the images as you are understanding the theory of a disease. Now next is students that how many were basic one-liners. So a lot of questions were one-liners, about 120 plus questions were direct one-liners. Now students, the very important point I would like to tell you is that the important topics are important, right? They are bound to be important. They have been important in the previous exams. They will be important for your future exams also. So from this INI, what we learn is that yes, the important topics cannot be skipped. For example, when you're studying infections, you need to know everything about tuberculosis, HIV, dengue, malaria, meningitis. Right? These topics cannot be skipped. Nephrotic versus nephritic syndrome. 1 or 2 questions are always there from blood gas analysis. Then other topics like spirometry. Right? All these topics are very, very important. Metabolic syndrome, management of diabetic neuropathy. These topics you cannot skip. So what we have learned from this INI CET, that these important topics, which are basically the PYQ topics, you need to enlist them and you start revising them, focusing more on these topics for your future NEET PG. So do not waste a single second thinking about how my INI CET went, how it could have gone better. It has already gone. What we have for our future is our NEET PG. So let's focus entirely on our upcoming NEET PG.